be doing my Foley catheter insertion. I've chose a female patient. So first thing I'm going to do is verify my physician's orders, gather my supplies. Then I'm going to go into the room and confirm the patient's name and date of birth, and verify for any allergies, and make sure that if they have a latex allergy, you get a latex-free Foley kit. And then you're going to perform your hand hygiene. You're going to put your gloves on. You'll position your patient, perform perineal care. You want to keep them as covered as possible during the process, just so they're comfortable. And then once you perform perineal care, you take those gloves off, perform your hand hygiene again. Then you'll start setting up your sterile field. So you'll open your Foley catheter kit, and you always would have a sterile area to your side, or if there's enough room at the foot of the bed to where you won't contaminate. So you're going to open away from you first, the sides, and then towards you. And then you'll take your drape and cover your patient so that only the area needed is exposed. Kind of hard to do with this, but then you can take this wonderful little pad here and create a sterile working area. Then you take your gloves, and typically you would have a table over here to do that on. I don't, so we're gonna work with what we have. And we're going to pretend like I'm not in my sterile area. I'm left-handed, so I will don that glove first. And if that happens in real life, you would stop immediately, get a new pair of sterile gloves. I usually bring an extra pair in the room with me. So in theory I would have, because it ripped, got a new pair of gloves. Take our trash over to the side, and then we will start setting up. So we'll get our alcohol swabs, and then I like to take my jelly, squirt it in here. Then I go ahead and I hook, I take my catheter, put it in the jelly, and I attach my saline syringe to the Foley. My kit doesn't have one, so we would attach that. And then I would go ahead and start wiping the patient. So we're going to open these. I'll take my non-dominant hand, open the labia, swipe top to bottom, discard, top to bottom, discard, top to bottom, discard. Then take the lubricant, make sure it's lubricated, and you insert 2 to 3 inches or until you see some urine. And you don't want to touch with your dominant hand. Sorry, it's a latex that silicone's having a hard time going through the latex. And then you would fill your balloon and then pull back till you meet resistance, and then clean up everything, and that's it. Oh, and you want to make sure to secure the catheter to the thigh with a Velcro or a Foley catheter securer. Those are different at every facility.